Another lady presented with a sore toe. A sore toe sounds that's pretty mundane, isn't it, a sore toe? Except you take the shoe off, you take the sock off, and the sore toe is pregangrenous sore toe. And the first thing you think about in someone like that is this person diabetic? And who's been looking after you in the meantime? Where do you normally go? Which medical centre do you normally go? Well, doctor, I haven't been to the doctor in, well, at least 30 years probably. And so on that particular day, we did her blood sugar, we did a urine test, and that makes the diagnosis. Once she's diabetic, and she's got a blood sugar of something like 34, which is huge. A normal blood sugar would be up to a maximum of, say, 7.8 or 8, and hers is 34, and she's still walking around without any problem whatsoever. She's got 4 pluses of sugar in the urine, and you take her over to the treatment room to get a better look at this sort of toe, and you find out that not only is it the toe, the first toe, but it's the second toe, partly the third toe, and it's a large area of skin on the front of the foot as well as on the underneath side of the foot. And you realise that there's an area of sort of separation you get an area of sort of dead skin on the feet. That's how people can sort of walk on their feet, with the area of dead skin acts as a sort of cushioning factor. And there's a cleavage area between the dead skin and the newer skin that's coming on underneath, and you realise that the whole foot is really infected. And there's a little sinus, a little something probably about as big as my finger that goes from the ventral surface of the foot that's coming, I don't know how far into the foot. And I did an X-ray to see whether she had in fact any osteomyelitis involved, and just a plain X-ray didn't really reveal that. But I suspected if we had done something were able to do an X-ray with a bit more resolution power, we would have found that would have been the case as well. So what do we do with her on the day? This particular lady, I sent her off to go and get some other investigations done, rather than just a urine test and a blood sugar that was done in the treatment room. And sure enough, she's got significant other factors, other abnormal tests involved as well. And brought her back the next day, redressed the toe and the foot. Had to try and find someone then who will look after this patient in hospital. And you have to ring around, you have to try and find someone that you can get to take the patient on to look after them. And that all takes time to do, because other doctors are really busy people, and they often won't ring you back straight away. But in fact, this particular doctor, I was able to get through to him, talk to him about the problem, and we got a bed for this lady in hospital that particular day. And I saw her recently, and she came back with a partially amputated foot, and she's on insulin treatment. And so that's, probably saved that lady's life, but didn't save her foot. But it could have been worse. She could have had a whole foot amputated, or a lower leg amputation if things had gone on any longer. And so with things like diabetes, a lot of people who are diabetic are out in the community who don't really know that they're diabetic, and she obviously didn't know she was diabetic, and she probably had been diabetic for many years. And the fact that she hadn't been to the doctor at all in all that time meant that she was never diagnosed.
Stay with me, I can make you glad you came. The sun goes down, the stars come out, and all that counts is here and now. My universe will never be the same. I'm glad you came, I'm glad you came.